Hello, Osler. This is David Koczerginski from Amritsar, India. The Global Health team had a very interesting day today. We had the privileged opportunity of visiting the Institute for Mental Health, Amritsar. We were welcomed by Dr. Goyal, who is the medical director of the Institute. He answered all of our questions, and we had many, with regards to the challenges of treating the mentally ill in this region. And he gave us a tour of the facility. Now, the facility is an old facility that was modernized about 2001, 2002. The facility treats predominantly individuals with chronic and serious mental illness. Individuals many of them have become somewhat institutionalized, in part because the community-based resources really don't exist in terms of psychosocial rehab and housing facilities. So individuals that are not connected to family supports end up spending much of their life residing in these facilities. Having said that, one of the things that we've been impressed by has been the slow and gradual changing of some of the treatment of the mentally ill in community-based hospitals. Just a few days ago, we had the opportunity to visit a inpatient mental health unit at the DMC, a large university-based hospital. And that sort of facility in a general hospital treating the mentally ill probably wouldn't have existed a number of decades ago. This has prompted a lot of conversations within the group about the need to continue that process, not just for the mentally ill, but in many areas of medicine, of spreading the care from a preventative basis well into the community and into the villages. With regards to the mentally ill, there's an opportunity to really enhance the conversation about mental illness, to destigmatize mental illness, to have conversations about addictions, which are a very significant problem amongst the young adolescent male population in Punjab, and amongst alcohol abuse amongst many of the more mature or senior individuals within the population. Suicide is a significant cause of mortality, premature mortality in this region, and that's another area that requires more attention and focus and discussion. We've had many discussions about issues related to gender equality, issues of spousal abuse. We believe that there's a tremendous opportunity by developing community outreach teams to engage a younger population in discussions around prevention of mental illness, addictions, and issues related to gender equality. We are very excited about the prospects to partner with healthcare organizations to help enhance these conversations, to facilitate the continued growth of the treatment of the mentally ill and many chronic diseases within the smaller villages and smaller communities. We realize that it is an enormous task, and we believe that over the course of a number of years, many years, that we at Osler can both learn a lot from our colleagues, our healthcare colleagues in India, and that we can provide a lot back to these communities. Thank you.